Hi, I'm Bill Blain, strategist at Shard Capital. This week we've been celebrating the 80th anniversary of the Battle of Britain. Now, I'm sure it's just a coincidence, but British casualties from the Blitz were around 43,000, and that's not a dissimilar number to the number of people who've died from coronavirus in the UK. This week we've also learned that over 700,000 UK jobs have been lost due to the lockdown recession triggered by COVID. Redundancies are rising at their fastest rate since 2008, and it's going to get worse as the furlough programme ends next month. Many believe the approaching winter is going to see the whole situation dive into a new low as a new wave of COVID deaths, a second wave, hits. And that's before we even consider the uncertainty of global trade, recessions, and the possible failure of the UK to agree a Brexit trade deal with Europe. It's all contributing to a deepening sense of doom and gloom. Every night there is yet more bad coronavirus news on the TV. We have become a very fearful nation. Now, the number of cumulative deaths in the UK ascribed to COVID is nearly 42,000. That number says very little about the human tragedy of each case, but it also says nothing about the increased numbers of deaths that we're likely to see from the big five killers that take 150,000, mainly elderly Brits, every year. We're going to see these numbers emerge shortly. It's going to be dementia sufferers who perish early, heart attacks which have killed because patients stayed at home instead of going to hospital, cancers that have been missed, respiratory diseases that were left untreated or even recorded as COVID, and strokes where patients missed that golden first hour because hospitals have been so focused on the disease. These are all very cold statistical numbers. There's no official data that will actually record the grief, the anxiety, the mental anguish the pandemic has raised. It won't record the social consequences of lockdown or the misery and hopelessness of those who've lost their jobs and are facing the difficulty of trying to find a new one while still paying their bills. The numbers won't record especially the shattered dreams of the young people who make up the bulk of employees in tourism, hospitality and travel businesses, and they're the ones who are most impacted by the job losses. That's got very serious implications for the future because what affects people in their teens and 20s stays with them for life. And these emotions, the negativity that has been created over the last couple of months is going to contribute to long-term economic underperformance because we are impacting expectations and sentiment. It all sounds very negative for the UK. What we're going to remember long term about the pandemic is all the fear and anxiety that's been created, but also the apparent confusion in government. I've got to say the sheer banality of the rule of six strikes me as mad when we're being told to go back to work. It feels like resilience has gone completely out of the window. We've become a nation of scared and anxious corona scaredy cats, encouraged to report on our neighbours, or sullen corona renegades, much like myself, who just want to get the economy moving again. The UK produces great statistics on death rates. You can find them on the government sites. They show that over the last 20 years, improved heart attack treatments have reduced heart attack deaths dramatically. But that fall has actually been matched by the rise in deaths from dementia and Alzheimer's. If one thing doesn't get you, the others will. It serves to remind us death is inevitable. And the bulk of corona deaths, as we all know, have been in the elderly and infirm. It is tragic, but the reality is death comes sooner if you're elderly and have other serious conditions. And the brutal reality is that COVID is an opportunistic predator. It picks easy targets, the weak and the vulnerable, just ahead of other conditions. And that's what flus have always done. If we actually look at the data, only 90 people under the age of 30 have died of COVID in the UK. That compares to 434 young people who died in road traffic accidents. Now, I don't know how many of them of the 90 had underlying comorbidities, but it's possible many did. Now, I'm not trying to demean or say that COVID isn't important. It certainly is very bad if you get it. And if you're overweight, like myself, it's likely to be worse. It can take some people months to recover from the long-term cardiovascular, gastric, neurological, and respiratory issues that it raises. But the brutal reality means that if you've got comorbidities, you're at more risk. Therefore, COVID can be seen as a risk. We don't ban people from using private transport because they're far more likely to die than they are of COVID. We acknowledge it's a risk that they are willing to take. But over the last 5 months of lockdown, we've seen that risk-reward equation disappear in the UK because of the enormous damage that the COVID virus has done to the economy. Well, hang on, it wasn't actually the virus that did the damage. It was our response to the virus. And it's becoming increasingly clear that the virus is not what we feared it might be. It hasn't become the medical Armageddon that we closed down our economy to avoid. Yeah, COVID-19 is serious and it makes people very ill, and it has killed large numbers of vulnerable elderly people. But it is not the big one. It is not a repeat of the 1918 Spanish flu, and it's certainly nothing like the Black Death. The story of the novel, new coronavirus pandemic started with the assumption that it was the big one, and that it was going to be a global disaster killing millions. That's what all the initial reports, including the all-important Imperial College one, told us. But it's turned out to be something very different and less dangerous. This time, it hasn't been the big one. That is still to come. But what we've experienced over the last few months should allow us to figure out what works and what won't work next time. Hopefully, when the big one does arrive, the tragedy and the challenges of the next pandemic can be cured without all the economic misery that we've inflicted upon ourselves this time. It is inevitable at some point in the next few years we will have the big one, a SARS or another kind of epidemic that will kill millions. What really has gone on is that we expected the worst and it hasn't occurred. And while over the last few months we've been panicking about COVID, the facts, the science and the data have been evolving. But that narrative of how bad it is has barely changed. It still dominates the news flow as if it was killing millions rather than just a very few. For all the flaff of lockdowns, working from home, rules of six, the danger and the fears about kids going back to schools or universities, and everything else that the corona Nazis have been fulminating about, we now know that there's far less risk around COVID than the received narrative continues to tell us. It's a lower threat. The real numbers and the real risks are getting explained by science. It's real data and real science that we're now beginning to see that should be driving the reaction, but that's not the way our emotions work. It's not how politics handles reality. The media isn't really terribly excited by, hey, this isn't as bad as we thought it was, stories. Politicians don't generally accept they might have been wrong. Reality is that lockdown really changed very little, and we know that because it now looks like the Swedes were right and we were wrong. They didn't close down their economy, we did. We've actually shattered our economy for very little gain. Careful social distancing and pragmatic shielding like in Sweden would have achieved better results. And I don't think the markets really understand that yet. They still think that economic recovery and global growth depends on the magic of a vaccine being found. Well, if they're waiting, they may be waiting a long time. To understand what's been going on and why we've been dragged around by lockdown for so long, we need to understand government and policy. It's looking clear now that there's been an overreaction, but let's not say that governments did it deliberately. For a start, most governments in the West acted in unison. When another country locked down, other nations did the same thing. They followed each other to avoid the charge of complacency if they didn't. The Swedes were the only standout. They took enormous criticism when they didn't lock down, but they stuck with their own plan. Governments haven't acted maliciously. They've all tried to do the right thing, but they are politicians. And at some point early in the pandemic, the UK government recognised that the worst possible outcome would be the vision of failing hospitals on the TV. And I suspect that avoiding that impression of crisis became the political imperative behind lockdown and the Fright campaign, the Save Our NHS campaign that followed. The economy and jobs definitely took second place as we clapped the NHS every Thursday evening. It became overly emotional. How silly is government going to look if we didn't need all that emotional twaddle? What we're now looking at is a virus that is less and less danger. We've now seen how the numbers have been working in the same way in nearly every single nation. The numbers went up rapidly and then all declined pretty much in the same way across the whole of Northern Europe and the northern USA. Now, it is different in other economies in warmer nations like in the southern states, but it has proved to be very predictable that immediately the virus came in, picked off the vulnerable, and then the numbers have fallen. The numbers also show that Sweden's decision not to lock down made zero difference in terms of death rates relative to other nations. The data shows the effects of the virus are actually, as many naysayers said, simply a bad flu. It's now clear the virus is a significant danger to a limited number within any population. You can protect them. We're increasingly beginning to understand that the consequences of the focus on the virus are the things that means we're going to see excess deaths rise from all these other causes as a result. Now, we can't really be sure of anything to do with COVID, including issues like herd immunity or reinfections, till we get much better testing data, and that's still a problem. We need to know who has had it and who has had the virus. However, it does look like places like Sweden, London, New York have achieved effective herd immunity on the simple basis there are few people still to be infected. Now, I reckon lockdown has been a terrible economic blunder. It was done with the best of intentions, but the facts and the science have become clearer. It's now apparent that lockdown occurred for all the wrong reasons. The challenge now is to change the politics, get economies reopen, figure out the real economic damage and address it, and cope with the consequences created by the monetary and fiscal crisis spending that's been put in place. And the one thing that I can say with certainty is I don't think markets are properly discounting the ongoing damage done by the lockdowns. They still think that the whole coronavirus crisis can be undone by a vaccine. But a vaccine doesn't solve the problem that we made a mistake in the first place. We are certainly not out of the virus woods yet.